Good afternoon, everybody, and welcome to another episode of WATS. Pastor Curtis Crider, Chaplain Crider, whatever you want to call me. These days, they just call me Curtis, and that's fine. But we're here to talk about a very important subject. We are, I know there's been a lot of conversation about COVID-19 and more specifically, the surge of the Delta variant. And quite honestly, some of us are just kind of fed up and tired of listening to it, hearing it, and maybe we've turned away from it. But the reality is, it's still happening. And unfortunately, our loved ones, friends, co-workers have gotten sick with the Delta variant. And unfortunately, some have passed away. So it is a reality that it is still with us. And today we wanted to just hone in on maybe an aspect that we're not hearing about. We call this segment Life on the Inside. And what we want to talk about is what's really happening on the inside of COVID-19. And what does that mean? What it means, what are patients and care providers, what they're experiencing, whether they're in inpatient or outpatient practices or hospitals, what are they actually experiencing? And oftentimes we hear others' opinions about what's going on and what's happening in hospitals. But we have a panel of guests who are going to talk to us about their personal experience. And so we'll have firsthand experience in terms of what they're doing, how they are dealing with some of the challenges that the Delta variant proposes or brings, and how they take care of themselves, because, you know, a lot of that matters in terms of the treatment or the care that patients are receiving. And so today, allow me just to introduce who our panel, who they are. I want to introduce Gregory Carrington. He's a nurse and has been in the field of nursing for quite a while. Well, Greg, you tell us a little about yourself as we introduce everyone.
Yes, sir. Thank you, Pastor Crider. I have been a registered nurse for about 18 years. I've worked in various areas. I've been a spinal cord injury nurse. I've been a surgical intensive care unit nurse. I've worked in the cath lab recovery area, PACU. At my facility, I was also heavily involved in the vaccine effort. At our peak, we would do anywhere between 1,000 and 1,200 vaccines a day. So wow. I've been heavily involved, particularly with the vaccine effort here during COVID-19, the pandemic, etc. And I look forward to sharing in the conversation today.
Wow, Gregory, it sounds like you've really been busy. Been busy.
Unfortunately, yes, I have.
Yeah. So another one of our guests today, no stranger to Mount Calvary, Dr. Dexter Frederick. Dr. Dexter Frederick, thanks for joining us today. Tell us a bit about yourself, sir. Dr. Frederick, you have to unmute yourself.
Yes, got it now. Yeah, again, thanks again. It's a pleasure to be here with my fellow panelists. But yes, I am a physician. I am a board certified internal medicine and pediatric physician. And I've been doing that for about 20 years or plus years now. And I am at the side of I'm viewing the COVID situation from the perspective that I see patients who come unvaccinated to my facility and succumb sometimes to the COVID virus. I have also been proactive in trying to create community sites where patients and community personnel can go and get vaccinated throughout the city. So again, pleasure to be here, and I'm looking forward to being in the conversation.
Dr. Frederick, we're happy to have you, and I can tell you two have been very active in the community, and you've been practicing for quite a while. So you come with a lot of experience, and we're privileged to have you this afternoon to just help us talk about this subject that we're going to discuss. The next panelist I want to introduce to us is Jessica Van. She is a respiratory therapist. Hey, Jessica, how are you doing?
Pastor Curtis, I'm great today. I've been a respiratory therapist for 15 years in a couple different states. I primarily only worked in the hospital, Before 2 years ago, nobody really knew what my job meant. But since everything has happened, it's actually come a little bit further up into the forefront. I usually work with anything heart, lung related. So life support systems like ventilators or more heavy duty things besides that, and all the way down to breathing treatments and oxygen.
Awesome. Yeah, we're glad to have you, Jessica. Look forward to just hearing the richness of what you're going to bring to this conversation today. And finally, we have one of our Mount Calvary finest, newest nurses joining us today, Miss Jada.
Hello,
Dickens.
everyone.
Hey, Jada.
You know, they say the best for last. As you may know, I'm Jada. Unlike all these veterans, I've only been a newly registered nurse for a month. So I'm excited to start my healthcare career and hopefully still be standing like everyone else, looking all good and strong. I am starting on a PCU floor, so a progressive care unit. So I deal with patients. They're pretty sick, but they don't need as much intensive care. And so it's kind of like that middle ground in a sense.
Well, welcome, Jada. Welcome aboard. Welcome to the medical field, and you're a new nurse. I'm sure you're very excited about your career, and we'll just keep praying for you. You know, you're coming in at a very intense time in the medical field, but your services are much needed. Hey, listen, everybody. Most of you know, for many years, for about 22 years, I was a congregational pastor, and most recently, this year, as of 2021, January, I became a full-time chaplain in a healthcare organization. And one of the things I get to do every day is talk with, is to really provide spiritual and emotional support for healthcare providers such as the ones that we have today. And it really is a privilege of mine to do it. I get a chance to see firsthand your struggles, your challenges, what you're doing, and I kind of see myself as that person, you know, who can just bring you, if you were a marathon runner, I'm bringing you that cup of water so you can drink it and keep on going. But I've recognized over time, over the last few months, how intense things have become. We went through a lull in the pandemic, or with the previous variant. And then we saw a surge once the Delta variant came along, and things really got busy. They ramped up, and so I have the opportunity to see and hear, and to hear what people are saying and how they're feeling, what they're thinking about it, and it just really piqued my interest when I noticed how important you are to your health organizations. You guys aren't robots. You are not, you don't work on any automation. You guys are human. And like I said, we're human. And we have real feelings and emotions, and we carry things with us in the work that we do that are of personal nature. And yet we are still expected, you are still expected to show up and do your job, and to do it at the highest level, because someone's mother, someone's father, someone's child is under your care, and we want them to be treated as special as they deserve. So it really struck me hard to my core when I realized that while the expectation is that you're going to carry forward your work, we still have to deal with this stress load personally, as well as what we are feeling from the ones we are providing care to. And I just wanted to talk about that, because sometimes people don't understand that. They don't get it. They just, they're not really able to understand what you guys are really going through. And so to get this conversation going, we're going to kind of talk about that. And I know some questions will come. We know that those who are listening will probably want to place some questions in the chat. Feel free to do that. We're not going to, just a few disclaimers. We're not here. We're not going to discuss any personal patients in terms from the standpoint of record, because we can't. People policy will not allow us to call names and all of those things. So But our panelists are going to talk about their experiences and in effect to kind of show what they do and how it might be impacting them and what they actually have to go to keep themselves up and ready to do their work. But here's a question I want to throw out to our panelists today. Okay, here's a question. From your perspectives, how real is COVID-19? And I know some of you are saying, oh, wait a minute, you're going to ask us that question. No, I'm asking that question because, there's some people who don't believe, who do not believe that COVID-19, no matter what variant it is, they just don't believe is real. They don't believe that people are actually getting sick from it. And they hear the numbers of how many are being hospitalized and how many are dying, but somehow they don't really get it. So can you talk to our listeners and just kind of give us a sense of reality? Is COVID real? Is this thing really happening? Anybody?
I'll start. Last year, I actually encountered a lot of people who were telling me it's not real. It's not real. And these were patients that I was actively working with and on that were telling me that this was not real, and everything that was happening to them was some other different experience. It was something else. It could not be COVID because they knew it was not COVID. This go around, this year has been a lot different because people are starting to know the patients that are dying. Last year, it was very hard to find people who was like, oh, somebody very close to me. It was always in the news. It was always in gossip. And this go around, it's just been a lot of people that you know. It might not be immediate family, but now you know somebody who's doing it. And a lot of people are starting to realize that this is really impacting a lot of the community.
Another perspective is, it's real when you're trying to unfortunately you become ill and you have to go to the emergency room and there is a long line and you in your mind are wondering where are these people coming from or why all of a sudden it's so difficult to get into the emergency room. And or you have individuals who your kids who are going to school and you met with the idea that the school is taking this seriously with mask and whatnot. So I think that yes, there are some people who will not believe it, and I think that has a lot to do with the impact and the mind influence of social media. I mean, how can you see in your face or see in reality what's going on and totally blank that out and come up with your own reality of what you want that reality to be? It's there are those who are going to believe it, those are not, more believing it, like Ms. Van said, because of the personal perspective. But my prayer is that individuals who don't believe it don't have to succumb to this, so that they have to lie on their backs, wishing, crying, and praying.
That is so true. Anybody else want to weigh in?
Just to agree with Dr. Frederick, being that, I am a little younger, social media is very important and heavy amongst our peers. And so it's a lot of videos and this, that, and the other. They're saying it's fake, it's this and that. So I do agree that because the role of social media, a lot of people, they think it's a joke, or they think that it's a government scheme, or they think that it's something else that what it actually is. My thing is, if to anyone listening, or if you know somebody that thinks it's fake, I would like them, hopefully no one has to go to the ER for real, but I would say just go to the ER and say you're going for something. I want you to see how long it takes you to get a bed, or how long it takes you to go to the floor that you actually will get your care in. When I started, I was starting at the peak of this recent wave, and it was people waiting days just to get a bed, just to even get the treatment started, because the hospital's priority is the COVID patients, and how many that they have to prioritize, or they have to do something quick, or they're going to die. So it's very real. It's not like, again, it's not a scheme. It's not fake. I promise you, none of us want to be doing this for fun. No, it's very real.
Yeah, yeah. Yeah, so I have to agree with you guys. I mean, I see it every day, and that question is so important because despite what you know, what you experience, and I'm sure you guys can talk from your, maybe what happened this week, how real COVID is, and the fact that we are seeing something different in the Delta variant that we didn't see in the previous one. The fact that the Delta variant seemed to be impacting a lot of younger people. I'm just wondering from you guys, what effect has that had on you, seeing younger people, or have you seen it in your practice or your whether you're inpatient, outpatient? Have you noticed that younger people are coming into the hospital and having a difficult time with the COVID-19 variant?
Well, I think one of the things that happens with most young people, I'm sure you all have heard the expression, I'm 10 feet tall and bulletproof, right? Most young people are healthy, active, very social. And so I think when COVID, first started surging, it was such a focus on the elderly. It was such a focus on those who had comorbidities. And younger people, teenagers, collegiates, well, I don't have any comorbidities and I'm not elderly.
Right.
So let's go out and have a good time. And unfortunately, when that happens, sure, you may have a lesser chance of, ending up in the ICU or, having it be fatal to you. But not only can you get sick, but you can also be a carrier, or you can spread the virus. And so I would say during the first surge, which impacted more of our northern states, here in Florida, we never got to that level. But as I believe it was Jada who just said, she just came into the profession a month ago. Well, a month or two ago, we were having our surge, and lots of collegiates and high schoolers were contracting the virus. And I think sometimes we focus a little too much on deaths. If I have to go to the hospital for several days, that's a bad experience. It's not something that has to be fatal for me to have been impacted by COVID. And I think that more and more young people have been impacted. And I think that's why we've seen a recent surge in vaccinations lately.
So when we talk about young people, kind of throw some ages up to me, because I think I'm still young, honestly.
I was thinking the same thing. An age when I was working before, under 65 is considered young to me to need like life support or have an extended stay in the hospital. And it's gone down. Young is now, 30s, 20s, teens. I don't usually deal with pediatrics like Dr. Frederick, but people, usually the younger without any sort of background issues, it only takes a short while, a couple hours to bounce back, or maybe a couple days to bounce back. And you're seeing young 20s needing full weeks in the hospital that's unable to work, unable to see their children, unable to really get a hold of their families. It's very intimidating when you don't have that much life experience and everything is put on hold and you don't know what's going on. It is terrifying for a lot of the younger people because they always thought they were invincible.
Wow. So go ahead, Dr. Frederick.
No, Jada, go ahead, Jada.
I was just going to say, I agree with Mr. Currington that, it is a lot of association with COVID and death. So in my experience, I haven't really had, I guess, like super young patients, but I've dealt with patients that have had COVID, but now are experiencing complications after recovering. And so rather it's breathing issues still, or sometimes they have have blood issues, even though, okay, they didn't die, they're still like, COVID is not like, okay, I just had COVID and I moved on. No, they're still battling with it months after they have been cleared, essentially.
Yeah, I was going to reflect exactly that same statement, Jada. Many people think that, oh, if I catch the virus, that'll be great for me because I will have immunity. Well, you're playing Russian roulette, really, because you have the option of really being in an ICU bed, being intubated and being tubes and whatnot. You have the option of not going there, but being hospitalized for 4 to 5 days, being on oxygen and slowly getting home. You have the other option of having a flu-like virus with high fever, being at home for 2 or 3 or 4 days, and eventually getting better. And you have the option of actually having the virus and have already spread it to about 50 to 100 people before you knew you got sick. So in any way, you have created a scenario where you have exposed yourself to a virus that's either affected the ones you love or affected your whole physiology, your whole body system, to the point where you may end up, because of the virus, short of breath for months and months and months, lack of energy, depression, blood clots, headaches, and just not feeling like the person you want to be. So there is those scenarios, and it's not healthy, and that's a perspective that I wish everyone could understand.
Dr. Frederick, you mentioned, okay, Bam, go ahead and chime in, and I have a question for you.
I just wanted to piggyback on something that Dr. Frederick said, and that is, I want folks to realize that this is relatively new to the scientific community, and long-term impacts, not just in 1 or 2 years, but 5, 10, 15 years down the road, we're not 100% sure what's going to happen. News outlets refer to it as long COVID. There are individuals who were healthy 30, 40, 50-year-olds who contract COVID, and for whatever reason, they're just not themselves. And so it's very important for us to take the necessary precautions. So, don't think, well, let me get it over with, build up some natural immunity. No. That's not what you want to do. You want to try to avoid contracting the virus at all costs. And so I think that's something that sometimes we're talking about, that younger population, they're invincible. We don't necessarily have all the answers yet. The scientific community is still kind of figuring this out and following and monitoring patients to see what type of long-term complications. On a side note, there's an individual that I know quite well who unfortunately contracted COVID and is still battling with trying to, quote unquote, get back to normal. She's like, I can't explain it, but I'm struggling. I'm just not myself. And so let us take every precaution to avoid contracting the virus and continue pressing forward.
So I know that there can be slim realities for the very minimal realities for someone who actually come in contact with COVID, and there are some extreme realities of someone who comes in contact with COVID. And unfortunately, I've had the opportunity, I've had to see both. Let me say it to you that way. I want you all to talk to me about, because sometimes we use terminologies. Dr. Frederick, you mentioned intubation. What does that mean? And I know, Jessica, that's going to get into your line of service. Let's kind of talk about what this looked like, what this may feel like, and, as a care provider, what are some of the emotions that you go through when you actually have to see a patient progress to that point?
You want me to take it, or Jessica,
Well,
since
you guys can jump in, it doesn't matter.
Well, I could start and have Jessica jump on, but the process of to the point where you get intubated, which is the artificial support that a patient needs to really maintain their life, and the oxygenation. You start out with oxygen. Normally, we all breathe in 21% oxygen. That's what we have in the air. Well, due to illnesses and diseases, and due to COVID specifically, that disease will impact the structural changes and the oxygen delivery in the lungs. And after a while, you will need more than 21%. You're going to need 50%. You're going to need 75%. And oxygen, the nasal cannulas, the little tubes will not do. And that's where we have to call in the doctors to put a tube in your larynx and in your trachea present to you and to give you the 100% oxygen that you need. And then, Jessica is called to bring that big machine to make sure that, the right volumes are being delivered, the right pressure is delivered, and the value that her and her colleagues bring to make sure that the oxygens are normal. I will tell you, and I was talking about this, that the respiratory therapists are the most probably undervalued individuals in the hospital. They're the ones that, go in before the nurses sometimes. They're the first ones that realize there's a problem with the oxygenation, that tell the nurses or the doctors. They're the ones that are right there to put the tube in and to take the tube out. They're the ones that are first called if the patient takes the tube out themselves. So I'll turn it over to Jessica because she's in that space, but take it over from there.
Okay. Oh, there's a lot. There is a lot. Usually for ours, when you're sick, your heart and your lungs, they try to compensate. They are the first things that try to compensate when you're sick or exercising, and they are the last ones to give up. And COVID has been affecting the lungs and the ability to actually get that oxygen into your blood amazingly well. It really, really affects people's oxygenation. And that's the oxygen that's going to your heart muscles. It's going to your brain. So if your oxygen is low, going to your liver and your kidney, we're seeing multi-system failure on the people who are having more severe symptoms. When you get to a certain level and it's just simply unsafe, we have high flow oxygen, and normally the nasal cannulas are only doing 2, 4, 6 liters. We'll go up to 80. And it's not a jet stream because science, but we're able to get that high. And when some people fail that, we're going on to pressure masks. We're going on to BiPAPs. We are forcing the air in and popping them open just to get a little bit more oxygen into their blood. And that's considered pretty extreme for most people. Most people do not have to get there. And then when that fails, or if that fails, I should say, then we're going on to ventilators. And we have to, it is very uncomfortable. Obviously, we are giving heavy duty sedatives just so that you are on it regularly, because that tube is not meant to be there. And the lining of the lungs seems to thicken. The lungs are supposed to be nice and elastic, and they turn into like solid masses that don't really move. And you're having just a very hard time getting the oxygen into the blood without extreme pressures. And the lungs are not made to have pressure slammed into them like that. So we're having multiple complications when it comes to life support systems like ventilators. And we have tried, there is a whole gamut of things that we can do, but when it starts to take its course and we're already on a ventilator, the numbers are very dismal. I will be absolutely honest. Our numbers are very, very dismal. And that is even for people without comorbidities, people who do not have, diabetes or old age. These are normal people without any history, medical history. You're looking at 1 to 5% make it. So we are running to do this to multiple people in a 12-hour shift. And we're having to pick up multiple shifts because even our coworkers are getting sick, and then they're going on the ventilators or they're leaving because they're too sick to continue. Yeah.
Wow.
Dr. Crider, I have one question for Jessica, if you don't mind.
Sure.
Because one of the things that I've heard with COVID, I'm not inpatient, but I've heard this, and knowing you in terms of what you do, normally you do a blood gas. So I have heard that if you have COVID, one of the things they're seeing physiologically is that the blood is very, very thick. Have you recognized that? Have you seen that?
I have seen that. I have seen that. We're having there is just a lot of stuff that seems to be going on with that. The hemoglobin, the actual red blood cells that are carrying for everybody else. The hemoglobin seems to be very thick. We are giving blood thinners to kind of counteract that, and COVID kind of sometimes causes blood clots in the lungs and in other organs. So we are trying to give blood thinners to actually go against that, and we have complications with that sometimes too.
Okay.
So it's and I guess it's important for us to understand that it's real. Things are happening, and we do see patients who get in severe cases, situations where they need the extra help just to survive. And I'm just wondering, Jessica, and maybe Jada, you guys may have experienced when you're in your particular areas, when people get to those extremes. So for PCU, I know, Jada, you may experience up to a certain critical level, and then that patient may be passed on to ICU. But when you see them progress, what does that do for you? Because I think our listeners need to understand that you guys are you're not mechanical, you're not automated. You guys are real people. So how does that impact you, knowing that there's been a shift in the health status of your patients, and now you're being called on to do something a little bit more and more intense to help them out? Is there anybody that can kind of just share with us some of the feelings and thoughts that go through your mind when that happens?
I'm gonna be honest. I don't really like take into account my feelings because like I'm here to care for them. So honestly, again, I've only been in the environment for a short time, but also it could just be that I don't know. It's like I just kind of space out on myself, if that makes sense. And then also, I don't know if this is like a ineffective coping mechanism, but hopefully it's not. But all of my friends, my very close friends, they're nurses as well. And so I kind of, I guess, use humor and just talking about it with them, like, oh, guess what? Yada, yada, yada. But as far as like seeing patients not get better after, again, that multiple hospital stays, again, I don't know. It's like I think to some extent before I graduated, I kind of prepared myself for the worst, being that COVID kind of came in during nursing school and like hospitals emphasize COVID and like get ready because, this is going to be very hard. Transitioning to nursing is hard already, but then adding this virus makes it 10 times harder. So it's just like, oh, well, we're getting worse. We got to do what we got to do.
Wow.
No, that's very true. Nursing is a challenging profession, and I want to say welcome, and to any other future nurses or people who just stepped into the field. It's a wonderful profession. These are unusual times, and like I said, I've been doing it for 18 years, and I've never seen anything like this, and I am hoping I never see anything like this again. So for all of you new grads, you guys are being baptized by fire. Because you have emotions that you have to learn to deal with as a new nurse. I remember seeing my first patient, get sick and get rushed off to the ICU. The first patient that died. These are all I know the names of certain patients that have impacted me or their families that have impacted me. In the moment, you have to focus. You have to keep working because you have other patients to take care of. But at the same time, Pastor Crider, no, we're not robots. It does impact us, and you do the best you can, and then you keep pressing on. But to all the new grads, hang in there, keep moving forward, and just remember this is as tough as I've ever seen. So you guys hang in there and continue helping us take care of all of our patients.
All right, we have some questions in the chat. Some our listeners are placing some questions. So let me take a few moments to ask some of these questions and let's see if we can get them answered. Someone asked, if you are fully vaccinated, is it okay to get the Regeneron? And what is it? Regeneron or monoclonal antibody. Anybody want to take a stab at it?
I've seen a few people come in who have taken Regeneron. You have to meet certain criteria to actually get it. They do fine, but I would like to actually asterisk that the people that come in who are fully vaccinated, in my experience for the last 2 years, who are vaccinated, they usually get mild to moderate symptoms. It is very few and far between that a vaccinated patient with no history is coming in with severe. What I'm usually seeing is the unvaccinated person. An unvaccinated person are the ones that are going onto ventilators and are coming in record numbers. Okay, so good job being vaccinated. That is number one to me.
All right.
Yes, I agree. And Regeneron is basically kind of an immune booster. I mean, you're just really just getting the immune system all revved up and really blocking from the physiological, all the cytokines, all the markers that really inflames the body. And you have to do it in the first 24 to 48 hours. I think up to 3 days, but you've got to do it right away. And I agree with Jessica. If you're vaccinated, for you to get to that point, normally you don't. But it's a great lifesaver. With our medical technology and research, it is one of those key things that are really reversing the course.
Mm-hmm. Okay, so I see another question here. Someone asked in the chat, the ones that are being hospitalized now, do they have the Delta variant? Interesting question. I don't know. Is there a way that are we able to distinguish?
So at our facility, we don't differentiate by variant. Other facilities may, but at my hospital, we do not. We just simply test for COVID. I don't know about the other panels.
I was going to agree. Yeah, it's either you have COVID or not. They don't really get into the specifics.
Okay. All right. I'm just making sure we've answered and get caught up with our question. Okay, so here's another question. So even if vaccinated, how can you avoid, in parentheses, your social distance, wear your mask, etc.? So I'm assuming that the question really is, if you're vaccinated, what precautions should you continue to take?
Well, there are a number of things that you can do. You can socially distance, you can wear your mask, you can wash your hands, but there's nothing that the scientific community or the medical community can say or do for you to make it 100% effective. There's no way to eliminate all risk. What I would suggest is minimize your risk and do a risk benefit analysis, for example. I mean, if is it necessary for me to risk exposure to go to a sporting event? Some people say yes. Obviously, football stadiums have been filled. Some people will say, you know what? I won't take that risk. So there is some, individual, I guess, choice, if you will. But I would tell you, if you're really trying to avoid the risk of contracting COVID, you want to minimize your risk. You want to take all the necessary precautions, but there's nothing that is 100%.
Okay. All right. Anyone else want to comment on that particular question?
Well, one of the things we all have to deal with is reducing our risk, right? And like Greg was saying, risk benefit ratio. And one of the difficult things, even as a Christian, is acknowledging that other people who we love, who are friends do not believe the way we do in terms of being strict or being cautious, and the fact that this COVID virus is still around. And sometimes you may have to tell a friend or tell a family, if your family is not in concert with what I believe in terms of vaccination, or in terms of wearing a mask, we have some hard choices to make in terms of how we tell them, well, we can't meet face to face, or we can't gather in our home, and that's a hard discussion. That's a hard thing to tell someone you love. So back to the answer is, along with those things Greg mentioned, mask and hand washing, is being, you know, um, righteously selfish, if
Mhm.
I could use that term, to save yourself, your family, your health, and staying safe.
Mhm. Yeah. Those were great questions, and we'll pick back up on the comments just a little bit little bit. I wanted to just kind of piggyback, because what we're leaning to in this conversation, what we're saying, what I'm hearing is, what I'm thinking, no one wants to come to hospital and become hospitalized and go and risk the possibilities of getting to this extreme sickness with COVID. And I think it's important for us to really color clearly what happens. And I'm glad, Jessica, I'm glad you and Dr. Frederick expounded on that process. Here's another thing that is a concern for you definitely for you as a healthcare worker. And it's simply something that we pay attention to, because no one wants to come to the hospital and not get treatment. But when you go through the surge like we experienced, there are all kinds of things that the hospital had to do just to accommodate the surge. We went to what we call a black status, and so certain services were shut down. Non-essential surgeries didn't happen, so that the hospital could now maneuver resources, human resources, as well as create capacity to have more patients to be hospitalized. So we had to go through these different changes to make sure we can manage the flow. But in the midst of that, we also heard, and I'll come to you in just a minute, Ben, but we also heard that, there was a shortage of resources. By resources, I'm saying personnel who either got sick, and I heard one of you allude to this earlier, who actually got sick with COVID themselves. Some of them, quite honestly, were afraid too of COVID, and some of them had to work extended hours or extended days. And this, I find, as I am attending to the needs of our care providers, I find that that also has taken its toll on you as a healthcare provider. So I just want you all to speak to that just a minute. How have you experienced? So has it really impacted the work that you're doing? Any just having a shortage of help?
So I'll take the first part of your question,
Okay.
Pastor Crider, and allow one of the other panelists to deal with the second one. But when you talk about hospitals making adjustments, that is something that I found the general public did not understand. I've had family members say, well, they say, the hospitals are at capacity. What does that mean? And your facility, you could call it a black status. And basically what that means is certain services, certain surgical procedures, they don't happen. Why? Because we don't have beds. We don't have rooms in the hospital to put you in to recover you after some of your surgeries. As I stated at the very beginning, I worked in the surgical intensive care unit for several years, where we would take care of open hearts, if you had a lung removed, if you had a kidney removed, etc. And one of the things that you have to do is you have to have adequate space to take care of the patients. And that is something that that during the surge that hospitals struggled with. So hospitals don't close. We don't put a close sign up and say, no, turn off the lights. We're not open. No. We do the best we can. We can put you in the hallways. Our EDs, our emergency departments will just fill up. And unfortunately, when this happens, you don't have additional nurses that you can just hire and bring on. We're trained professionals. There's a learning curve. And just because the need increases, it doesn't mean that our resources do. So at our facility, we had, extra shifts. You give me 3 patients, you give me 10 patients. I'm gonna take care of it the best way I can. And that's not even counting the mental fatigue that you suffer when you have to go in day after day and you're just maxed out. You're just maxed out doing the best you can for as long as you can. So that's something that I would really like the folks who are listening to understand, is that we do the best we can for as long as we can. But when we run short on staff and resources, and when we're just getting beat day after day after day, it does take a toll. And I'll turn it over to someone else to continue to elaborate.
Yeah, going back on that Black status, man. So kind of like on my experience, like I said, the ED, I feel for all the ED nurses. I have a friend that's starting the ED. So during the surge, ED wait time, probably the minimum 2 to 3 days. There were some people waiting 4, 5, 6 days, again, just to get a bed. And so we got the ED swamped. There were units that normally didn't take a certain acuity of patients. They were turned to COVID units, complete COVID units. And so you have to think, okay, staff members, even though we are health professionals and we are here to help people, we do sign up for a certain specialty and a certain type of patients to take care of. That's our choice. And so you have to imagine that, I come to work with surgical patients or med-surg patients, but now my unit is a complete COVID unit. I have to only work with COVID units. So there you go with the staffing crisis. Some nurses, like I said, the veterans, y'all can leave. Y'all can do travel nursing. Y'all can go to outpatient. Y'all can go to wherever you want to go. So then there puts the need on the new grads rushing us in to try to fill in those needs. Wow. And then it's patient displacement. So like I said, with my floor, there's a certain acuity that my floor is on. I wouldn't say allowed, but that we can only care for in the safest way. And so we have sepsis patients now. We have small surgical patients, or just patients that we wouldn't normally take care of. But, why can't they go to the floor that they usually would be on? Oh, their unit's a COVID unit. And so the Black status is, like I said, the staff really takes a hit on it. For the surgical nurses, being that some procedures were canceled for a time being, they would displace those nurses. If they want to work on a COVID unit, that's fine, but then they would come to our floors and just help out with the, again, full capacity. And like I said, that full capacity, it's just, the doctor would discharge one patient literally within 15 minutes. The nurses are getting a report for another patient coming to replace that room. I mean, the room is not even clean yet, but we gotta go. We gotta get them out. And so that's, I think, again, that staffing needs. And again, new grads, like say, again, we wanted to work with a certain specialty, recruiters are saying, this is all that we have right now, or we really need your help here. So, it's either you sign up, come help, or, go somewhere else if you, really don't want to. But in a sense, staffing needs and crisis is a very real thing.
Yeah.
To jump on to Jada's stuff, we unfortunately had a new grad nurse have a complete anxiety panic attack during shift. We were putting way too much on her as a brand new grad. And it was the day Pastor Curtis wasn't there. Otherwise, he would have fixed it. But when you are just running on full mode all the time, and you just get tunnel vision for, I need to do this, I need to do this, I need to do this. You are not looking out for the next person next to you. You are simply assuming that they can carry it, and they will say something if they don't. And a lot of the staff, they don't want to be the weakest link. And we are giving them a lot more, 3 times as much work as you would normally give a nurse. And they don't want to say, oh, I don't know what to do, to the point that they are crying and just so overwhelmed because we just gave them way too much, and we're so focused on something else that we're not taking care of ourselves. I've definitely cleaned rooms to get patients. I have actually taken a mop and wiped down a room myself because we didn't have time to wait for somebody to come and clean it properly. We had to be the ones to come and clean it properly because we have 15 minutes to get that patient into the room. I have personally set up ventilators on floors that were not meant for ventilators. So our ICU was completely full. ICU rooms are a lot bigger, and they are set up for this big equipment. And so is the post-surgical care units. But I was actually running electrical engineering numbers on wattages with our engineering department to make sure we would not pop a circuit on these floors that were not made for this. So it was a huge safety issue. Well, it wasn't a safety issue. We made sure it wasn't, a fire hazard, but we had to now do extra just to get more bodies somewhere in our hospital that were never meant to be there.
Wow.
Yeah, I mean, to make it more, give you more of a visual, I think what all of you have just described basically is a MASH unit. It's a war zone, a medical war zone, that there are implications for all our health providers who are facing this every day. And one of the things that we all have to pray is that God continues to nurture us and build us up and allow us to know that this is his work, because what's happening and what the unknown in the next 3 years is the burnout, and the traumatic experiences that subconsciously is happening right now, that can influence the journey that as health professionals we take after this. So I think it's important for us to nurture one another, to encourage one another, because it's an emotional roller coaster from day to day.
It really is. And see, it is good. I'm so glad you all are just, leaning in on what's really happening, because, all of this matters. And unless you come into the hospital, you don't really see this. You don't understand the realness of it. And then also the things that are happening, quickly, to make sure that patients are taken care of. And as you hear our healthcare professionals saying, it does place a burden on them. It does put a strain, a stress, and so it's important. I'm so glad that you guys are talking about this. And one of the things I get to do, and Jessica, what I do, we have to kind of help deal with some of the emotional fallouts that are happening, and to try to, in real time, work through it, process it, because we know how important it is for the patient. We know how important it is for the family. And most importantly, we know how important it is for you, because you don't want to go home knowing that someone, something happened that maybe could have been prevented, or, that doesn't make for a good evening, good week for you as well. So we know how important that is. I got a couple more questions that are coming in the comments, and a lot of these questions are leaning toward the vaccination. So it tells me that our listeners are very concerned about the vaccination. So let me start with this one that says, how does COVID normally spread? Is it primarily airborne, by touch, or both? So we'll go with that question. What would you all say? Let's answer that one quickly.
I'll take that one. We normally do contact precautions. We will always be wearing gloves when it comes to people, but it is through those coughs, that is a lot of the reason why the masks are important. It is not necessarily to prevent you getting COVID, but that is a very good way to stop you from spreading it. Your sneezes and coughs are one of the biggest things. It's a droplet. The germ is in your saliva, it's in your snot, and you normally breathing or coughing is going to spread it around. So when we're talking about masks, it's polite to wear a mask because you are not spreading it. It is not necessarily going to protect you, but you are protecting others by wearing a mask. It does go airborne if you are taking nebulizer treatments. Airborne means you do not, it's not, it will stay in the air for up to 10 to 15 minutes. If you are taking a nebulizer treatment, that's for like your asthmatics. So we have kind of tried to stay away from nebulizers in general because of that. But usually just touching a body and washing your hands, you don't really need to worry about that. Washing your hands is important. Don't touch your face unless you've washed your hands first.
All right. Let's see. There's another one. We got to move a little quickly. Our time is getting short here. I just want to make sure we pick up. Oh, there was a question here. Let's see if I can find it again. And it says this: if you get the vaccine, does that show lack of faith that God will not protect us? If you get the vaccine, does it show that it's lack of faith that God will not protect us?
Well, let's go ahead and talk about that. There are people who believe that you should pray and that is the end of it. So they don't seek medical attention at all. I would say that that's not a position that I hold, and that's not a position that I believe Jesus would hold. I believe that the medical advancements that we have made over the decades is a way that allows us to have a positive impact on the world and those around us. So for example, whether it's blood pressure medication, whether it's any kind of surgery, any kind of medical procedure, if you believe in those things, then I would tell you that this would fall in the same category. Now, there are times where people get you get a second opinion, but to declare the vaccine, to not get this vaccine, does that show a lack of faith? We have to read into the question a little bit, or not to get any vaccines at all. I will say this: I don't personally know anyone who refuses all forms of medical treatment. I have heard about them, I have read about them, but I haven't met anyone like this. So this is the part of the conversation that we really haven't gotten into. There's been a lot of misinformation, and that is not only on the medical side, but it can also be on the spiritual side as well. And so for the individual that asked that question, I would ask a couple of questions to you. Are you opposed to blood pressure medication? Are you opposed to all surgical procedures? If you say no to that, then I would tell you that I don't believe that a lack of faith would be a adequate comparison. When you have a text or a chat, you can't put everything into the text or chat. So again, I am reading into it a little bit, but I think that if anyone says, I'm not getting the vaccine, and this is just my thought process, I'm not putting this on any of the other panelists. If someone says to me, I'm not getting the vaccine because I think that shows a lack of faith, but they're taking blood pressure medication, or they've had any medical procedure, I would ask you, how is taking that blood pressure medication not showing a lack of faith? How is having a cardiac stent, as I stated earlier, I worked in the cath lab, not showing a lack of faith? Do you buckle up when you get in the car? Is that not showing a lack of faith? And so my question to you would be, is it this vaccine? Is it some of the political and religious, information that's being spewed out there that's causing you to put this particular vaccine in that category? Or is it all vaccine? Is it all traditional medicine? And so I would simply ask whoever asked that question to ask themselves some questions and see what answers they come up with. That's just my personal take on that particular question, and I'll turn it over to another panelist.
All right. Well, you put it in a very practical. You gave a practical perspective, a practical application to it, and let's be honest. There are a lot of things have happened quickly. The vaccination came about as a way to help us get through this. And yes, there's been a lot of politics. I don't want to get into all of those things that have really maybe tainted our understanding of the vaccine, or maybe our reason for not wanting to do it or doing it. That would probably be a whole nother conversation. I guess the thing that maybe I want to ask you guys as health professionals, and maybe to what extent you may know this, what is the vaccine designed to do? What is it really, what is the purpose of it? And maybe that might clear up for some what, whether they want to do this or not. What is the whole purpose of getting the vaccination? Does it mean that I'm not going to get COVID-19? Does it mean that, just what does that mean? If when a person get vaccine, what's actually the expectation they should have?
So a vaccine in general, whether it be polio, tetanus, or whatever it is, it's supposed to stimulate the immune system and replicate the same virus, the same infection that you're supposed to actually contract, but doing it in an inactivated form, meaning that it's not the true virus, but it's inactivated to stimulate the immune system to prevent antibodies against that virus. And it's to prevent that virus from infiltrating the part of the body that can kill you, right? Mm-hmm. So in this case with COVID vaccine, the virus, the vaccine is to stimulate certain antibodies in the body to create a block from the virus infiltrating into the lung tissue, into the mucosal tissue, into that tissue where the damage will happen rapidly and whatnot. So that is kind of quote unquote what the vaccine will do. What has happened is that, and that's why a lot of people are against the vaccine, because how can something develop so quickly? Here, you've heard that it took about 10 years, 20, 30 years to get the polio vaccine taken care of. Well, hey, we did this in 2 years. Well, the fact of the matter is, since 2005, the research has been going on. That's how we fought the Ebola virus and how we stopped that one. So with the new technology of mRNA, and all that means is that the mRNA uses technology to replicate the antibodies much faster, millions of times much faster than we did with the polio vaccine. So the idea is you have this vaccination that stimulates the antibodies to prevent the virus from sticking to that corona shell. That's that's why we call it corona. It looks like a circle round with little spikes. It prevents that virus from sticking to that spike, which then can push into the lung tissue that causes death. So once you get that vaccine, you then create a barrier. Now, can you break through that barrier? Yes, but in terms of the millions and millions of viruses that can permeate the lungs, you may get, in trying to give you a headshot of it, maybe 300, which is not enough to kill you. You may get a little flu-like symptoms, but you're not going to go to the hospital. Mm-hmm. So in a nutshell, hopefully that can explain it.
Yeah. Hey, Dr. Frederick, thank you for explaining that. And I think there's always this continuous need for education in terms of what the virus is intended to do, how it works, and so forth. And for us in the faith community to really understand faith in God, remember God uses people. He said, I use the simple things to confine the wise. God has allowed mankind, for us scientists, to come up with different remedies and cures for some of the illnesses that we're facing that would probably under other conditions we would be dying from them, but that wisdom is there. And when the Bible says that we're wonderfully and fearfully made, it means something to it. God has given us a certain intelligence to do it. And so whether we want to follow that or we want to bypass it and say, well, we just want to follow God, just remember how God works through each one of these entities. And we just got to pray. And I believe that faith without works is dead. We got to have faith in God. But we also, as we have faith in God, prayer works, prayer changes things, but prayer and working towards something, working toward a plan also move things along in a timely fashion. Now, I realize that we still have a few more things we want to talk about, and our time is running short. And this has been a really robust conversation. I just want to thank you, panelists, healthcare providers. Let me also say this to you, that I appreciate the work that you all are doing. To go to your various jobs each day and to do it, and to carry the strain, the stress, and to do what you do. I just want to give you all a big thank you. And I see already our audience are also congratulating you, thanking you as well for the work that you do, because it really does make a difference. We see that the surge is plateauing, it's coming down. The numbers it seems to be going in a really good direction. We pray and hope that it does and continues along that process. I just want to, as we start bringing it down to a close here. One of the things what would be your advice? I know we're talking about the vaccine. Well, what would be your advice? And I want to say in this program, we are not here to tell people, we're not promoting or pushing one way above another. And I think the panelists will agree that, with our God-given choice and with the amount of research and education that's available to us, we need to educate ourselves on what the vaccine is capable of doing. And we know that there are still ongoing studies about some of the effects of it. So we just need to kind of pay attention to that. But we're not advocating necessarily one way or the other for you. You need to make that decision. But what this panelist has done, and preferably you've gotten it, we want to show you the real deal. What's going on? What's happening? And if you don't want to come to the hospital and be in these extreme situations, or even in some of these less severe situations, we want you to take control of your circumstances and make the best decision for you, knowing that whatever you do may affect your family or your loved ones. It may even impact your coworkers. So I just want you to take a real good listen in terms of what we're talking about and decide what you want to do. Now, as a closeout, we're bringing this down to a close. Panelists, what would you do here's a question. What would you say to someone who might be considering getting the vaccine? What would you say to someone who may be considering, maybe on the fringes? Is there something that you can say to kind of help them move in the direction? And we're not going to ask you guys if you've been vaccinated or not. That's not the issue here. But what would you say to someone?
I would fully encourage you to do your own research. Please do your own research, and just typing into Google and not looking at the source is actually rather important too. Please stick with .edus, journal articles. I'm a science person, so I like that stuff. But if you're going to do your own research, make sure it's not just someone saying something. Make sure it is like scientifically peer reviewed, because that's what I like to go by. But from my experience, the vaccinated people are not coming in with severe symptoms. The vaccinated people may come in, but they are in very small numbers, and they have mild to moderate symptoms. I personally have not seen a person that was vaccinated die solely because of COVID. However, conversely, the unvaccinated people are coming in droves on this wave. And it's a small population that's coming in. Like there's a very large unvaccinated population getting COVID, but that small population that is actually getting sick enough to get hospitalized go very severe, very fast. And from the point that you are going onto a ventilator or life support, the science from the last year and a half say that only 1 to 5% of everybody going onto a ventilator will survive. Doesn't matter the age.
And let me just say this. I have family members whom I love who are vaccinated. I have family members who I love who are not vaccinated. I will tell you the same thing I told them. What are your concerns? What are your worries? What are you fearful of? Answer those questions. Then look at the risk, look at the benefit, and then make a decision. I think it's very important for us to understand that we don't all think alike, just like we don't all look alike. I work with folks who are very strongly and advocate for the vaccine. I have folks who are hesitant. I'll piggyback with what Ms. Van said. Do your research, read, but be honest with yourself and analyze, why am I asking these questions? Is this something that I heard, or is this something that I've experienced? Did this come from someone I trust, or did this come from me researching or just typing a search into Google? And remember, when you type in these searches, the algorithms that they use to bring the articles up first are the ones they think you're more prone to click on. So if you have done a lot of research against getting the vaccine, those are the articles that's going to populate first. If you do a lot of research to say why I should get the vaccine, those are the articles that will pop up first. So it's very important to recognize that. A lot of times in our modern world today, let me go to Google and see what it says. But if I type in Google and Jada types in Google, it's going to bring us up 2 different search items first based on our past searches. So that's just something I want everyone to be aware of and be mindful of. Research, come to your decision, and always respect others' decisions.
Yeah, I would fully agree with what Ms. Van and Mr. Currington say. You have to analyze where your fear is coming from. I personally have now realized the huge role social media has played in the influence of really everyone, because it's just crazy that, again, people will see one thing online or they see one video and then it's like, how did you get to this point? Or, the common sense starts to get lower and lower in a sense. So again, you have to just analyze where your fear is from. I would say, speaking more towards my age group, that, it feels like we're invincible, that, this is a older person thing, or this is I'm not 80 years old, I'm fine. No, I would say, our immune systems, yes, are very healthy and going down. Once it's gone or compromised, there's, that's really it. And it's sad to me sometimes, like I said, to see people in my age group just live kind of recklessly and not take precautions, or they have the resources to get vaccinated and, they don't want to, or whatever reason it is, you're kind of playing with your life in a sense, because again, while our bodies are very strong, it's very fragile in the sense of once something is gone, it's gone. There's nothing us as medical professions we cannot do about it. There's, it's gone. So just again, analyzing where your fear is coming from. Also realize that, I know you guys have heard this, but we have all had vaccines, at least one in our lives. And again, for my generation, we couldn't go to middle school to a certain grade if we didn't get a certain vaccine. So it's not, it's not something that's just pulled out of water, and it's not something that the government is just pulling out, that hasn't been done before. And I would just say the last point, you just have to think of others in this time period. I know living in a very selfish world, it's hard to see the effects that you can have on someone, but you just have to know that my actions do impact someone. And, it's best to try to play your part as best as you can, if that's the decision that you want to make.
Wow.
Very well
Youngest
said.
one is most thoughtful. Wow.
Yeah, she's a well-seasoned 1 year nurse, or 3 months. But I'll keep it short. Basically 50 million people have gotten the vaccine. Side effects, maybe let's say 5,000 side effects, right, from the vaccine, if you call them side effects. Another 50 million may not have had the vaccine, and those numbers, 600,000 people have died, and going up to 700,000 people. The risk of it is, if you, no matter where you're at, after you've done your research, there's a risk of you dying. There's a risk of you having a low quality of life. If you do get the vaccine, you have less than 0.1001% of having any side effects from it. That's the facts. That's the reality. It's up to you. But on behalf of, myself, please get the vaccine.
Thank you so much, everybody. You guys really have really made this conversation very rich and interesting and inspirational and insightful. And I just want our listening audience to know that, these things were not said to discourage you or to scare you. Really, they are intended to encourage you and to keep you hopeful. And if you're looking for answers, hopefully you found some today. But above and beyond, I want to say this. I've been a minister of the gospel for a long time. And we are in a time. We're in a time and in a space where we gotta trust God to work on our behalf. And I just want to share this scripture with you, this very powerful one. I use it all the time. I use it throughout the day to just remember myself and to claim the presence of God in my life. Isaiah 43, and some of you know this all too well, verse 43 and verse 2, it says, when you pass through the waters, I will be with you. Through the rivers, they shall not overflow you. When you walk through the fire, you shall not be burned, nor shall the fire scorch you, for I am the Lord your God. We are not without help. We are not without strength. We're not without resources, because God has promised to us whatever we're going through, whether it is the waters, the troubled waters of COVID-19, whether it's the fiery experience of what we go through when we are feeling emotionally overtaxed and fatigued and just worn out, whatever it is, God says we'll go through it, but we'll come through on the other side. So we have to trust God. And the most important thing I want to say to you folks, if you don't have a relationship with God, get one, have one. Don't just depend upon your own information, your own wisdom. Depend upon the Lord's wisdom. And I believe that God will carry us through and get us through this, not only this season, but he will get us through the next season. So we thank you for listening. Thank you, panelists. Thank you, Dr. Frederick. Thank you, Jessica. Thank you, Bam. Thank you, Jada. Jada, even though you're a new nurse, you just seem like you have an old soul. And God has really blessed you with a lot of wisdom, and we know that you're going to do some great things. So before you go, panelists, I just want to pray with you. And I just want to pray God's blessing over your ministry and what you're doing, and as we bring this program to an end. Father in heaven, we're so grateful, Lord, that you've given wisdom to men and women. You've shown us, Lord, what you're able to do through us, and you use us in unique ways to perform mighty works of care on behalf of your people. God, we're here just to be your hands and your legs and your ears and your eyes, God, to just be able to take in and love the people the way that you would love them. And in a critical time, it's just to just remind us and them, God, that you love us and you care about us. So we're grateful, Lord, that you've done this for us. And We pray that you will bless our panelists today as they continue to do their work in providing measures of healing and health for families and patients. And we thank you for WATS. We thank you for Mount Calvary. We pray that you will continue to bless the ministry to flourish and to grow, and to also bless our church, that it will continue to be that beacon of light in the times that we live in. We thank you for this opportunity, and we pray that you will bless us and keep us. Through Jesus Christ's name we pray. Amen. Now, before you all take off and leave next month, we are looking at, and this comes from your leader. Next month, we're looking to address parenting in this new age. And if I can get my phone working, parenting in this very new age versus old school parenting. And we like to be able to consider some of the things that could be done to help encourage the next generation. So we want you to stay tuned for that up and coming program. It's going to be exciting, and hopefully it will enrich the lives of our families. So God bless you and keep you as we sign off today. We grateful for the questions. We tried to answer all of the questions. I believe we did, but if we didn't, just forgive us. But if you still want those questions to be asked, we'll find a way that we can get those answers to you. God bless you. Thank you, everyone.